This is Sky News Breakfast, and these are our top stories. Cutting the quarantine. Self-isolation for fully vaccinated people with coronavirus is reduced from 10 days to a week.
We want to reduce the disruption to people's everyday lives caused by the pandemic.
Safeguarding the future. How a vaccine's blueprint could allow new jabs to be developed within 100 days of a new virus being detected. 70 million years on, scientists discover a perfectly preserved dinosaur embryo that was preparing to hatch from its egg.
And I'm in Winterfell for a world first as Sky News gains exclusive access to the new Game of Thrones studio tour in Northern Ireland.
The weather turning more unsettled from today, bringing a risk of colder temperatures as we head towards Christmas. And at 1:45, we'll take another look at the papers with the presenter and writer Matthew Stadlin and the journalist and broadcaster Ramona Ali. Morning all. The self-isolation period for fully vaccinated people who have coronavirus is being cut from 10 to 7 days with immediate effect. The move follows confirmation from Boris Johnson that no further COVID restrictions will be brought in before Christmas. He says the situation remains finely balanced, with the government waiting on figures of the number of people going to hospital with the new variant. But many are expecting new restrictions before the new year. Here's Laura Bundock.
No COVID curbs before Christmas, but the rules are changing for self-isolation. The 10-day period now down to 7 days.
We want to reduce the disruption to people's everyday lives caused by the pandemic. So today we will be cutting the self-isolation period from 10 days to 7 days for those people that take a lateral flow test on day 6 and day 7, and the result of both those tests are negative.
It comes as Christmas is given the go-ahead, but what happens next is much less certain.
We continue to monitor Omicron very closely, and if the situation deteriorates, we will be ready to take action if needed. And what this means is that people can go ahead with their Christmas plans, but the situation remains finely balanced, and I would urge everyone to exercise caution.
Meanwhile, in Scotland, bigger decisions have been taken. Edinburgh's Hogmanay won't happen, with large New Year events cancelled. Limits too on sporting fixtures. The uncertainty in England is hitting hospitality hard.
At this point, we are normally sold out for New Year's Eve. We normally sell out early on in the Christmas period, so early December. We've sold about 1,000 tickets compared to the 2,000 tickets that we usually sell. So we've got about £50,000 worth of ticket revenue, that we've accumulated. But we're looking potentially at being faced with having to refund all of that money.
The rapid rise of Omicron makes it impossible to rule out further measures.
Cases of coronavirus remain high, above 90,000 cases a day. The biggest concern is around the rapid spread of Omicron. This chart shows how much it's gone up in just the last 6 days, up by a third to over 60,000 cases. And hospitalisations have increased slightly, but remain well below the numbers we were seeing during the previous surges in infections.
The rate of hospital admissions will be critical in the coming days. Also important, vaccination. And news now the Oxford AstraZeneca team is tweaking its jab for Omicron. But as we head towards Christmas, celebrations feel muted. Families finally together, but well aware it could all change very soon. Laura Bundock, Sky News.
There are well over 60,000 confirmed cases of the Omicron COVID variant in the UK. More than 15,000 of those, in fact, registered in the latest 24-hour period. Overall, another 90,629 COVID cases have been recorded, along with 172 more deaths. And that brings the total number of deaths to 147,433. As for vaccines, almost 40,000 first doses have been delivered, more than 50,000 second doses. That means the total number of second doses now more than 47 million. What of boosters, third doses? Well, almost 900,000 of those were delivered in the last 24 hours, which brings the total to almost 30 million. Joining us once again on the programme, the Health Minister, Gillian Keegan. Ms Keegan, always great to see you. Do hope you're well. Just apologies, we can't be in the same studio during this festive week. Let's start with a personal admission from all of us. It's not feeling very, very Christmassy this week, is it? But the Prime Minister has said that we will still be allowed to go with our Christmas parties. On what basis has he come to that decision?
Well, on the basis that, you know, we're taking sort of balanced and proportionate approach to it, and, you know, people can still go ahead and have their Christmas. I would disagree, actually. I had a family meal yesterday, and it did feel very Christmassy, particularly as my sister made it over from the States. So, yeah, it's feeling Christmassy. Families are getting together, sometime for the first time in nearly 3 years.
I don't know, maybe I'm just playing into the stereotype of the Scottish curmudgeon this morning. But let's talk about the data.
I think you are.
Let's talk about the data, though. Do we have a figure for how many people are in hospital at the moment with Omicron?
Yeah, there's 129 people in hospital with Omicron right now.
The reason I ask, and I'm sure you will be aware of this, on the daily brief, the daily update, the Omicron update, it did suggest that there were some issues around IT reporting. Those issues have now been dealt with.
Well, look, we're getting data from all across the country, from every hospital, which is being fed up on a daily and sometimes hourly basis. So, you know, there's obviously some lags in certain bits of the data, but that's the data that we're collecting, 129 people as of yesterday, and 14 deaths with Omicron.
Just in terms, though, of what is happening, do you feel like we are approaching the peak of Omicron, or perhaps have even peaked? But Paul Hunter from the University of East Anglia suggesting that numbers may have plateaued. We would have been expecting, perhaps, if we go on the growth rate from 2 weeks ago, perhaps 200,000 cases a day. Instead, we're reporting around about 90,000.
No, we haven't been given that information. We're watching the data very, very carefully. I mean, you had 3 meetings yesterday where we're all discussing the data and taking in those inputs. So we don't know that yet, but we are looking at the wave and we're looking at all the data, and we'll tell you when we think we've passed peak.
So we haven't yet seen a major rise in hospitalisations if we generalise across the country, but there is an expectation that one is coming, though, isn't there?
Well, you know, the things that are unknown, which I think we've said a number of times that they're still working on, is the severity of the disease and also the impact of the vaccination, and now, more importantly, the vaccination plus the booster. We know the booster gives a huge increase in defence, which is why we're urging everybody, and thank you so much to the nearly 30 million people who've come forward. But for everybody else, if you haven't had your first dose, it really is never too late. Come forward, start to get yourself and others around you protected.
Just in terms, though, of the negotiations, it feels like there are negotiations going on around the Cabinet table. Your boss, Sajid Javid, none other than the Health Secretary, understood to have been in favour of bringing in restrictions earlier. He told his colleagues that doing nothing is an active decision, but he was outvoted. Do you think he was correct to be outvoted around that table?
Look, you know, around the Cabinet table, obviously you've got to get everybody with the different views, looking from a different perspective. One will look from health, one will look from the economy, one will look from transport, etc. So that's why you have a Cabinet government, so you can get all of that diversity of views and then take a balanced approach to risk. And it is a difficult decision. We do not have all the information that you would like to have at your fingertips, in particular, as you were talking about earlier, the severity of the disease. So it is a difficult balance, but we think we've got the balance right. You know, saying to the country we wanted to lock down, etc., when you've got those kind of figures, wouldn't look proportionate. So we're trying to be balanced, we're trying to be proportionate, but most importantly, we are monitoring the data on a daily basis. A couple of times a day, actually, we get new inputs of data, and that's what we'll continue to do. We'll be working all over Christmas, and we'll continue to do that.
So was the First Minister of Scotland wrong to go further than the Prime Minister then? Does she know something that he doesn't? I thought they were working from the same data set.
They are, and they have been all the way through the pandemic, but obviously the devolved administrations have taken different approaches at times, and you know that's their you know, their authority to be able to do that. you know, people look at the data. The data's no different, but I guess the way they analyse the risk could be different, or they look at their population. You know, we've taken a look at it, and we've basically said, you know, the hospitalisations, the deaths, where we are right now, as you said, the rise in cases, whilst the case numbers are very high, you know, they haven't yet reached what was estimated only a week ago.
Sure, but just in terms of further restrictions, it is fair, isn't it, to say that it is a question of when and not if?
Well, obviously, we've said we have to keep that option open because, you know, we are looking at cases that are going up at the moment, and we are looking at hospitalisation, which is going up. I was on the programme last week and it was 10 then, now it's 129. So obviously we do have to reserve that option, and we won't hesitate. We've said that we will not hesitate if it's required to keep people safe. But right now, the balanced and proportionate response is, we believe, the one that we've put in place.
Big announcement in terms of isolation. For those that are fully vaccinated, at the very least, the self-isolation period to be cut from 10 days to 7. What is the science behind that? Why are we now confident that people can be out, you know, mixing in the community again at day 7 rather than day 10?
Well, what we've done is looked at whether serial testing on day 6 and day 7, how that the risk of that versus waiting till day 10. And effectively, they've said it's equivalent risk if you have day 6 and day 7 negative tests is equivalent risk to having another 3 days in your bedroom or whatever.
But you are asking people who do leave their homes on day 7, having had those 2 lateral flow tests, you are asking them to minimise social contact, you're asking them to avoid mixing if at all possible. Why is that necessary if it's safe for them to leave the house on day 7?
We're saying that for everybody. We're saying to everybody, look, be cautious if you're going somewhere. I mean, we had a family meal yesterday. Everyone took a lateral flow test before. Make sure you go to somewhere that's well ventilated. Be cautious. We're saying that to everybody. You know, there's a lot of unknowns here. We still, you know, don't have all the data that we want. So be cautious. Be cautious to enjoy your Christmas.
As much as anything else, is this perhaps a means by which we can help out the really significant staffing pressures that there are in the health service at the moment? I mean, the BMA estimating between 32,000 and 130,000 could be off work by Christmas.
Yeah, I mean, that's part of it, keeping the economy going, keeping the supply chains going, keeping the NHS going, keeping yourself going. You know, everybody who's involved in jobs right now, for sure, that is part of looking at whether people can, with the equivalent risk, can get back to work earlier. So, yes, that is part of the equation.
A big package announced by the Chancellor yesterday, £1 billion to go to the hospitality sector, £6,000 for every individual business. Isn't that a little bit like trying to fight third world famine with a packet of frozen peas? I mean, I spoke to one venue owner yesterday who said their daily takings at this time of year are close to £6,000.
Yeah, sure. I mean, look, what we're not doing is looking to try and, compensate all of that. What we're looking to do is to provide a security blanket for businesses, like we did all the way through the pandemic. I mean, we've spent £407 billion on businesses and business support. So, you know, we're just trying to do that for this period of time. We know it's really unfortunate, obviously hitting just before Christmas. It is really unfortunate. So to provide that lifeline, and hopefully once we can all get back out, the great British public will do what they do, and they'll support all of these businesses and get back to the theatres and get back to restaurants.
Sure, but you described it as a security blanket. If it is such, it is pretty threadbare. I mean, Tim Rumney, Chief Executive of Best Western, he says it's just so disappointing and underwhelming in every sense. It doesn't go far enough opinion, it doesn't go deep enough, and it's too little too late. I mean, why have we not reintroduced furlough?
Well, because people are still working. I mean, I went out for a family meal yesterday. You know, there was the pub was, not every table was full, but most of it was. You know, people are still going out and people are still enjoying themselves. So, you know, we're trying to get that balance again. But actually, most businesses I've spoken to are actually very appreciative of this support. So obviously you found one there that doesn't think it's enough. You'll always find that. But, you know, this is £1 billion that we have just announced, and it is there to support businesses across our country, hopefully for a short period of time, until we can, get over this latest variant and the wave of disruption that it's caused.
But just in terms of wages, because that clearly has been something that many in the industry have been calling out for assistance. The move on statutory sick pay helps the firms, but it doesn't help the 1 in 6 hospitality workers, perhaps as many as 240,000 people who don't qualify for it.
Well, I mean, it's there, again, for those smaller firms to make sure that people can self-isolate for up to 2 weeks. The government will pay. And, you know, it's been very welcomed, I think, from most of the businesses that I've spoken to and from what I've heard as well. You know, this is something, again, we're dealing with uncertainty. We've responded really quickly to this latest uncertainty. We hope it doesn't last too long, but that is, you know, £1 billion that's been announced, and it is not something that should be dismissed. It's something that I think largely is welcomed.
Minister, let's return to the top of our interview, where I, self-described myself as a bit of a grumpy Scot. Perhaps you can lift my mood. I mean, in your mind, on the basis of the limits that people are already putting on their own activity, as you mentioned, you were in a restaurant yesterday and not all the tables were used. In your mind, if we carry on this path and people keep doing what they are doing, is there any chance whatsoever that we might not see that circuit breaker lockdown that, frankly, everyone is predicting?
Again, as I've said, we're waiting for data on the severity. We'll still have to wait to see, where we land on that. But we can't really say. All we've said is up to Christmas, we're fine, looking at the data, looking at the numbers we have at the moment. But, of course, we have to look at where this virus goes, where this variant goes. So we have to look at that data. I can't tell you in advance of getting that data. But you should be cheerful, because we're doing a lot more than we could last year. We're able to see our family. As I said, I have my sister and her family over from the States. We haven't seen them for nearly 3 years. So lots of people are getting to see family members that they haven't seen for a long time. And lots of us will get together with our loved ones at Christmas.
Gillian Keegan, lovely to have you on the programme, and you make sure you have a lovely Christmas when it comes.
You too. Happy Christmas, and cheer up.
Never. Now, Israel. It is to roll out a 4th jab of the COVID-19 vaccine. A government advisory panel says that those over 60 and healthcare workers should get the jab first, but it could eventually include other groups. Israel was, of course, one of the first countries to vaccinate and carried out the first booster campaign last summer. Researchers have published a blueprint for making millions of new vaccines within 100 days of a new virus being identified. That's a quarter of the time of the current COVID jabs. Our reporter, Katie Barnfield, is in the newsroom. Morning again, Katie. Walk us through this. It feels like an announcement of significance.
Potentially, it could be, yes. So these researchers say they've identified what they say are fairly simple changes to the manufacturing process of certain vaccines that could make it much more efficient and therefore produce new vaccines much more quickly. Now, the team is from Oxford University, and this research relates particularly to a type of vaccine called an adenoviral vector vaccine, which includes their own Oxford AstraZeneca coronavirus jab. And they say the thing that takes time when you're producing these particular type of vaccines is making a new seed virus. So the way that they work is by using inactivated or weakened forms of other viruses in order to produce an immune response. And they say they've looked closely at how that particular part of the process can be done more quickly. And with these improvements, it could enable clinical trials within 60 days of the identification of a new virus, and possibly millions of doses, as you say, to be made within 100 days, and even up to a billion doses being made within 130 days. Now, this particular team at Oxford University are now looking at how they might be able to tweak their own Oxford AstraZeneca jab to respond particularly to the Omicron coronavirus variant. Now, we know that the Oxford AstraZeneca jab currently has a lot less effectiveness against Omicron than other types of vaccines like the mRNA vaccines, including Pfizer and Moderna. But now the team are saying, well, now we know actually that we can change our viruses and modify them more quickly than possibly previously thought. So they say in conjunction with AstraZeneca, they've started the preliminary process to modify these vaccines, and then depending on the data, seeing whether it's needed, they might be able to start producing it fairly quickly.
Katie, thanks very much indeed. Other news, and Russian President Vladimir Putin has blamed the West for escalating tensions in Europe. Russia has amassed tens of thousands of troops on the border with Ukraine, amidst fears it plans to invade the east of the country. Mr. Putin threatened a military response to any aggressive course of action by the West. and demanded that NATO refuse to accept the former Soviet state as a member.
The build-up of the United States and NATO's forces next to the Russian borders is of great concern, as well as large-scale military drills, including those unscheduled. We're extremely worried about deploying the United States' global missile defense system near Russia.
A Madagascan government minister said he swam to safety for 12 hours after his helicopter crashed at sea during a rescue mission. The helicopter came down during a search for survivors of a cargo ship that sank with the loss of 39 lives on Monday. The minister used one of the helicopter's seats as a float to swim to shore.
I am alive. I arrived safely in Mahambo, and I'm grateful to all the fishers and villagers of Mahambo. Also to the hotel manager, Mr. Jason. I have been swimming from yesterday at 7:30 p.m. to today at 7:30 a.m. It wasn't my time to die, thank God.
Scientists have discovered a perfectly preserved dinosaur embryo in southern China. Dating back just a little less than 70 million years, the dinosaur was preparing to hatch from its egg like a bird. Speaking to me earlier, Fionn Wassam Ma, a paleontologist at the University of Birmingham who helped research the discovery, said the fossil is one of the best dinosaur embryos ever found.
This dinosaur embryo fossil is one of the best preserved dinosaur embryos ever found in history. So because it is so well preserved, we can look at how this little dinosaur lies inside its egg. And so we can compare its posture with the other dinosaurs as well as their descendants, the modern birds. So if we look at its posture, we can see it is very similar to a close to hatching modern-day birds.
Festive food is, of course, a big part of Christmas celebrations. And this year, the royal family have revealed their recipe for the perfect gingerbread house. Well, not their recipe, the Buckingham Palace chef's recipe. They've put together a step-by-step guide on how to bake and decorate the gingerbread from scratch, making it look just a little easier than it might eventually prove to be when you try it at home. Time for the weather.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
The weather will turn more unsettled from today, bringing a risk of some winteriness as we head towards the Christmas period. Much of Britain will start the day frosty and clear, but a few freezing fog patches are possible. Elsewhere, milder, with patchy rain across Ireland, especially in the blustery south. That rain will extend north and east during the morning, reaching Northern Ireland and western fringes of Britain. Most other places will stay dry, with cloud increasing, but East Anglia and the southeast should hold on to some brightness.
The weather, sponsored by Qatar Airways.
Now, the self-isolation period for fully vaccinated people who have coronavirus has been cut to a week, just so long as they test negative on days 6 and 7. Meanwhile, Boris Johnson has reassured the public that Christmas will be able to go ahead, but without further restrictions. Joining us now, Professor Mike Tildesley, member of the SAGE subgroup on scientific pandemic influenza group on modelling. Good to see you this morning, Professor. Let's start with that which we heard from the Prime Minister yesterday. And I imagine for a lot of people who've been building up to December the 25th in their minds, the fact that we will not see any restrictions this side of Christmas will please them. But from a scientific point of view, from a modelling point of view, is this the correct thing to be doing right now?
Well, it's a really difficult time of year, of course. I mean, we always say, as a modeller, you always say if you're going to introduce restrictions, then of course, the sooner you introduce it, the more effective any of those restrictions are going to be. But of course, at this time of year, it's really challenging because, given what happened last year, the very late introduction of restrictions a few days before Christmas, I think that was quite damaging for people's mental health and well-being. So I suspect there's one eye on that, one eye on allowing families to be together. But of course, we do need to remember the Omicron variant has not yet gone away. There still is a risk attached to being in close proximity, particularly to vulnerable people. So I think we need to be very mindful of that in the run-up to Christmas.
Yeah, certainly it does feel, and it's obviously just anecdotal experience of my own. You know, you wander around high streets, you go through, past pubs and restaurants. It certainly does feel that people, in advance of any further restrictions, are limiting their own social contact, and certainly plenty of people that I know will be testing themselves regularly over the days to come, leading up to Christmas. But again, there feels almost an inevitability that there are some further restrictions coming on the other side of Boxing Day, or would you disagree?
Well, I find it very difficult to predict at any point when and if the government are going to react. But of course, if we are looking at cases, they are rising. We do need to, of course, take that in with the mind that actually the number of tests that are being carried out has also risen quite significantly over the last week. But of course, from what we are seeing in the data, Omicron is spreading rapidly. We're not yet seeing that filtering into an increase in hospital admissions in a significant way, other than in London. Of course, London is a little bit ahead, as it has been at various points throughout the pandemic, and there's a big concern in terms of the rising hospital admissions in London and also the relatively low vaccine coverage in London compared with other parts of the country. So that is a concern. The evidence that is coming out, though, is still suggesting that vaccines are very, very effective, particularly after a booster shot. So really important that we get as many people as possible continuing to get their boosters.
But just in terms of the data, isn't it the case that, you know, for the size of a data set that you would need to provide some reliable information on case hospitalisation rate for Omicron itself, we might be waiting until the new year?
Well, the problem is, of course, there's always a lag. And we talk about this throughout the pandemic. There's always a lag in the data. So when we see cases, these individuals were infected a few days ago, but obviously when we see cases, it can take a week or two before we start to see a rise in cases reflected in a rise in hospital admissions. And then, of course, when people sadly die from the disease, that happens a few days later. So any increase in cases, it's a delay before we see an increase in hospital admissions. We're not there yet in the data to really be able to say confidently the relative severity of Omicron over Delta. There's some anecdotal evidence that suggested that it's less severe than Delta, but we're not there yet in being able to say that definitively. So really being able to accurately say what the risk associated with Omicron is.
Professor, I'm going to be slightly cheeky here and ask, if you do not mind, what you're planning to do for Christmas this year. Have you had to alter your plans, amend your plans, cancel plans?
Well, I'm not yet having cancelled plans, but I'm really hoping. I mean, I've been a little bit careful in terms of not really going out kind of mixing in the way I was before, because my hope is that over the next few days, I may be able to see my more elderly loved ones. I mean, to me, Christmas is about my children, and I think it's really important that they have an opportunity to be around their loved ones over the next few days. So fingers crossed we'll be able to do that. But of course, you know, there's one eye on the data, and I'm also making sure that I'm testing myself regularly. So if I am going to see my more elderly loved ones, I'm not putting them at risk.
Well, do you know what? I will keep my fingers and toes crossed for you. Professor Mike Tilsley, good to see you again, and have a very Merry Christmas when it comes. Fingers crossed.
Thank you very much. You too.
Welcome back. The number of people in hospital with the Omicron variant has risen to 129. Now, that's more than 12 times what it was just a week ago. The government says it still doesn't have the information it needs to decide whether further restrictions are likely after Christmas. Speaking to me just a few minutes ago, the Health Minister Gillian Keegan says the government takes into account a range of views when settling on an approach.
Around the cabinet table, obviously, you've got to get everybody with the different views, looking from a different perspective. One will look from health, one will look from the economy, one will look from transport, etc. So that's why you have a cabinet government, so you can get all of that diversity of views and then take a balanced approach to risk. And it is a difficult decision. We do not have all the information that you would like to have at your fingertips, in particular, as you were talking about earlier, the severity of the disease. So it is a difficult balance, but we think we've got the balance right. You know, saying to the country we wanted to lock down, etc., when you've got those kind of figures, wouldn't look proportionate. So we're trying to be balanced, we're trying to be proportionate, but most importantly, we are monitoring the data.
So, shorter isolation, no more curbs at Christmas, but there are fears that there is some bad news just round the corner. Our political correspondent, Tamara Cohen, joins us from Westminster. Good to see you again, TC. What did we learn from the Minister this morning? I mean, I think I counted about 7 or 8 times they are keeping the data under close review.
That's right. And she thinks that the data does not currently justify a lockdown. What the Cabinet and what ministers have seen so far does not justify taking that step, which of course would mean a big hit to the economy. She's saying it's not Cabinet ministers or Tory MPs standing in the way of Boris Johnson bringing in restrictions, even though they have been brought in on the basis of the same data in Scotland and Wales already. She's saying that we need to wait to have something firmer, although she didn't say what in particular they were looking for, with some suggestions that the UK Health Security Agency might be producing more data later this week. What they're watching very carefully is hospitalisations, and she said that the number of hospitalisations from Omicron that have been confirmed is now 129, 12 times higher than last week. Now, we must remember that there is a lag in hospitals reporting whether these are Omicron cases, and in the SAGE documents released over the weekend, they said that there may be 10 times as many as have been publicly reported. So there's a lot of uncertainty about the hospitalisation numbers and great concern that they have already doubled in London over the last couple of weeks, London being the epicentre of the cases at the moment. But they are watching it very carefully. There's a sense of when, not if, in terms of more restrictions after Christmas. But she told you to cheer up about Christmas because it will be a lot better than last year.
Yeah, I remember that. Tamara, thank you. Well, as new restrictions are brought in to suppress the spread of Omicron, care homes, which support the most vulnerable in society, are concerned over limited government guidance. Joining us now on the programme, the Chief Executive of the National Care Forum, Vic Rayner. Vic, great to see you this morning. Can we just start with what the government has or hasn't advised the care home sector to do? What is the current advice from Whitehall as to how you should be proceeding as we edge into Christmas?
Yeah, so you're right. We're waiting for large tranches of government guidance to be updated. You'll remember that perhaps about nearly 2 weeks ago, there was a press release which talked about changes that were going to happen and have an impact on the care sector. Particularly in relation to testing of staff, changes to the testing regime, changes to the visiting guidance, and a range of other things that were going to come in relation to admissions and other sides of things. So far, we've had the guidance around visiting, but that is the only formal change that has been announced. Other things have been kind of announced via press release. So testing is a really good example. So in the press release, it was announced that there would be a change in routine testing from 2 to 3 LFD tests per week for all care staff. Now, that's a really significant change. At the drop of a hat, you've suddenly introduced 1.6 million more tests into the system, many of whom need to get tests, LFD tests, if they're domiciliary care workers, from either the home testing order line or from their local community pharmacy. Well, I don't know if you've been out recently to try and get an LFD test, but you can't get them for love or money, either from the order line or from pharmacies. So you're asking a huge workforce to change the way that they work and not providing the prioritisation for access to those tests that they need, and not indeed updating the formal guidance. So you're getting people to work via press release. It doesn't feel like a very effective mechanism for such an important part of the regime.
Yeah, and on top of that, Vic, of course, as we know, as soon as you increase testing, you increase the number of people who will test positive, which is, of course, very key if you're working in the care sector. You want to guard against people catching, the residents catching, but at the same time, it is going to put even more stress on an already overstretched care home workforce, which could potentially, one imagines, lead to people perhaps not being able to see their relatives over Christmas.
I mean, I think the really important thing is, you're right, this is putting pressure on a workforce that is already under extreme pressure. I mean, I was particularly noted yesterday that, you know, the hospitality sector very rightly was outlining the pressures that Omicron restrictions were put on it. And within a week of them doing that, £1 billion was found for grants. The social care sector has been outlining the enormous workforce shortages that it has been experiencing since the summer, since July of this year. There's been a massive problem around recruitment and retention. And yet it took 4 months for the government to come up with £162 million. Now, that's an important amount of money, but that amounts to essentially about £100 per worker for a 5-month period. It's not enough. There's not enough priority on the impact of all of these changes and indeed the rapidly increasing impact of the virus on the workforce. Absolutely.
Sure. Vic, I mean, absent some very clear advice coming from government in the immediate future, there will be any number of care home providers up and down the country looking at what to do over the next few days. From your perspective, would you wish to see care home operators taking the initiative themselves, acting in their own minds to protect their residents, but limiting or indeed cancelling people being able to see their relatives inside care homes over the Christmas period?
So, I and the organisation I represent, the National Care Forum, has spent months and months, in fact, over the last year and a half, fighting very hard for access for visitors. And I think we have got to a really important place around having essential caregivers who can be part of the same testing regime as staff and are part of the essential well-being of people. I would be encouraging care homes across the country to continue to have that access for those essential caregivers. It's an important part, it's a vitally important part of people's well-being, and I think that we need to be finding ways in which we can continue to support that and continue. If staffing is the challenge, then we need to find ways to continue to boost those staffing levels so those essential visits can continue to take place.
Vic Rayner from the National Care Forum, always good to see you. You have a lovely Christmas when it comes.
Yeah, thanks.
And go to school, we would make a big difference to the air pollution around our school. Yeah, like us.
Most places will have a dry and frosty start, but Ireland will be milder with some patchy rain. That rain will spread into Northern Ireland and western fringes of Britain during the morning. Most other places will stay dry despite cloud increasing. It'll be breezy and cold for most, milder in the southwest. The afternoon will see patchy rain spreading across more of Britain with snow for the Scottish Highlands. Looking at the UK's air pollution, levels will remain low with values of 2 or 3 on the Daily Air Quality Index.
The Air Quality Report, sponsored by Philips Air Purifiers.
Joining us once again to take us through their selection of the papers, the writer and presenter Matthew Stadlin and the journalist and broadcaster Ramona Ali. Good to see you again, guys. We're a bit pushed for time, so Matthew, let's dump on in with a fantastic traditional Sun front page carrying a fantastic traditional picture of the Prime Minister. Well, not quite the Prime Minister. Looks a little bit more like Matt Lucas.
Yeah, have a good Christmas, but don't have a good Christmas. And I'm sure lots of people watching this morning will remember much earlier in the pandemic, during, I think, the first lockdown, when the comedian Matt Lucas made that video go viral in which he said, go to work, don't go to work, go outside, don't go outside. And this is a nod to that video by The Sun, suggesting ongoing confusion as to what sort of festive period we can all expect over the coming days. Now, we know that there are going to be no further restrictions in England ahead of Christmas. That gives some certainty. But at the same time as saying our plans can go ahead, the Prime Minister is warning us to be careful, to keep an eye out for our loved ones, particularly those who are vulnerable, to keep the rooms ventilated and so forth. And the Sun front page also making the point that there may be further restrictions ahead after Christmas. So while Christmas can go ahead, New Year might not in the sort of way that we normally expect. So a lot of uncertainty still, and this is feeding through to businesses. They crave certainty because they want to know what sort of orders that they can put through in order to give us the sort of new year that we hope.
Ramona, it does feel, you may disagree, but it certainly feels to me like people are heeding the Prime Minister's advice, that people are trying to limit their contacts. And the reason is, of course, is that no one wants to catch COVID and have to self-isolate over Christmas. However, as your story in The Independent points out, at least they'll only be isolating for 7 days now.
Yes, that's right. It's breaking just today that self-isolation is going to be reduced from 10 days to 7 days following negative lateral flow test results. So the UK Health Security Agency is saying that anyone infected can take 2 lateral flows 24 hours apart on day 6 and 7. And if they're negative, they just stop quarantining. And as sod's law would have it, I've just emerged from a 10-day isolation period myself. It was very uneventful. There was lots of tissues and Netflix and boredom, but this is really great news as it's minimizing the disruption to people's lives. And people there are tens of thousands of people infected with this new variant. So many of my own family members and friends are. So this is really important in kind of giving us a big chunk of our daily lives back.
I was wondering which of the two of you was going to be the Grinch this morning, and I know, looking at the paper list, that it's going to be you, Matthew. Page 9 of the Mail. Junk food should get cigarette-style health warnings. What on earth is this all about?
May I just add a quick caveat, because it is so important in a pandemic. I think there is a caveat to what Ramona said, which is if you are not vaccinated, you still have to isolate for the full 10 days. So this new guidance applies to those who are vaccinated.
I'm not sure that's actually the case, Matthew. Let me just read you something that my political correspondent Tamara Cohen sent me. She says that she's told by the Department of Health that the press release that stated the unvaccinated would still have to do 10 days is incorrect. It is 7 days regardless of vaccination status, but still 10 days for unvaccinated contacts of positive cases. So that's where there's perhaps the confusion has crept in.
That's very interesting. So in other words, the papers have to catch up on that. Yes, so to go to your story on the Mail, this is a report in the BMJ Global Health, and this is researchers saying essentially that junk food, so highly processed, ultra-processed food, is the new tobacco, and that we should have tobacco-type warnings on our junk food. So maybe if you buy a packet of cookies one day, you'll see the sort of damage that might eventually contribute to causing inside you, much in the same way that on a packet of cigarettes, you'll see diseased, cancerous lungs. A lot of people will support that. Others will say that that's going far too far towards a nanny state. Really interesting to see how that develops, because, of course, we have a massive problem with obesity in the country at the moment. And we've got a voluntary traffic light system, so it's only voluntary. But soon we will get those pre-9 p.m. non-advertising of junk food. And that's a big drive that this government has been part of and that Boris Johnson has personally championed.
And now I really want a burger. Ramona, take us to the front of the Daily Star. I think it's probably the front page of the day for me. Dear Santa, well, what does this Christmas card ask for?
Well, it's like a luxury box of lateral flow tests. It's like the gift that everyone needs, but not necessarily, like we've really been hoping for. And the front page here is commenting really on the impact that this is having on children, who are growing up, in this COVID world, 5-year-olds knowing words like, social distancing and isolation periods. So this story really nods to childhood kind of being robbed and the memories of Christmas without family is kind of like going to be haunting them, unfortunately. But, they're growing up with this uncertainty and parents can't even reassure them. But children are also very, amazing. They can adapt to environments and they're kind of getting used to this kind of uncertainty, unfortunately.
Yeah, that I think is something we will reflect on in many years to come. Matthew, perhaps the picture story of the day. Don't know why you picked this one out. Santa Paws, the headline. My director is currently gushing over this picture, I can tell you.
A really good news story off the back of all the COVID news and the idea that children, how are they going to develop in the future on the back of the sort of story that Ramona was just talking about. Here's some good news. Here's something we can all smile about. And these are Shetland sheepdogs, I think, most of them, about 6 of the 7 you can see there. And this is Kaylee Garrick. She's a 31-year-old paramedic up in Scotland, and she dresses up her dogs and sells the images for charity, but also shows the pictures to some of her patients in the ambulance to distract them from the pain, and also puts them up in hospital as well. Now, I've got 2 dogs through my girlfriend. I was not a dog person at all before I met my girlfriend. Now I absolutely love them. In fact, last night I just tweeted a couple of images of our working Cocker Spaniels. I'm not sure I'm going to be dressing them up in that Christmas hat I've got just over my shoulder. But I think this is the sort of story we all need. We all need to do a bit of smiling ahead of Christmas.
Just to inform our viewers, the Shetland sheepdogs are named Fenton, Tiago, Thorin, Gimli, Murphy, Jarrah. She also has an Alaskan Cleekai called Ghost and an eighth, which can sometimes be seen, another Shetland sheepdog, Fianna. Absolutely lovely.